Welcome to the Deep Dive. Today we're tackling a medication that seems to pop up in a surprising number of contexts. Spironolactone.
It really does.
We've pulled together quite a bit of information for this one. We've got stuff from, official sources like the NHS, the FDA, also patient info sites, plus a medical textbook perspective. Wikipedia, of course, even looked at pricing on GoodRx, and some medical news updates.
Yeah, a real mix.
So imagine someone you know just got prescribed this. They probably have a lot of questions, right? It's kind of what we want to dig into.
Exactly. Our goal here isn't just to list facts. We want you to get a real feel for spironolactone. Like, what is it really? Why might someone be taking it?
How does it actually work in the body?
Right. And crucially, what are the key things you need to be aware of if this medication is relevant for you or maybe someone you know?
Okay, so let's start right there. What is spironolactone in, simple terms?
Okay, so fundamentally, it's a prescription-only medication. It comes as tablets.
Right.
Now, it's interesting because it kind of falls into a few different drug categories.
Right.
A big one is that it's a diuretic.
Helps you get rid of fluid.
Exactly. But specifically, it's potassium sparing, which means it helps you lose fluid without losing too much potassium, and potassium is really important.
Okay, potassium sparing. Got it.
But that's not all. It's also technically called a steroidal antiandrogen and an antimineralocorticoid.
Whoa, okay. Steroidal, antiandrogen, antimineralocorticoid. Those are mouthfuls. Can we unpack those a bit?
Yeah, let's break them down. Steroidal just means its chemical structure looks a bit like some natural hormones.
Okay.
Antiandrogen means it can block the effects of hormones like testosterone, androgens, basically.
Oh, okay. And the last one?
Antimineralocorticoid. That means it works against a specific hormone called aldosterone.
Aldosterone, right. I remember that one being involved in fluid balance, blood pressure, stuff like that.
Precisely. It's a key regulator. So spironolactone is hitting things from a couple of angles.
Interesting. So if you get a prescription, what names might you see on the bottle?
Well, the most common brand name is probably Aldactone.
Aldactone. Oh.
You might also find it combined with other diuretics in one tablet, like lacilactone, that's spironolactone plus furosemide, or L-dactide, which has hydroflumethiazide added.
Combination pills. Makes sense.
And really important generic versions are widely available.
Which usually means potentially lower cost.
Generally, yes. That's a big plus.
Sounds like it's not a brand new drug then. Has it been around?
Oh, yeah. It has quite a history. Discovered back in 1957, actually.
Wow.
And it started being used medically in 1959. So, yeah, it's been around the block.
That's quite established. Okay, so let's move on to why a doctor would prescribe it. What are the main medical uses?
It's surprisingly versatile. One of the major uses is for heart failure, specifically heart failure with reduced ejection fraction, or HFrEF.
That's when the heart isn't pumping blood out effectively.
Exactly. And there's a really important study, the Aralorus trial, that showed spironolactone significantly cut the risk of death for these patients.
That sounds like a huge deal.
It absolutely was. It really changed practice, made it a key part of therapy for many people. Guidelines now point to using it in certain stages of heart failure, but you have to watch kidney function and potassium levels closely.
Right.
And interestingly, there's some newer evidence suggesting it might help in the other main type of heart failure too, HFpEF, where the heart pumps okay but doesn't relax properly.
Oh, how so?
It might help reduce hospital visits and potentially slow down heart muscle stiffening, what they call myocardial fibrosis, but it's not quite standard treatment there yet.
Okay, so heart failure is a big one. What else?
High blood pressure. Hypertension. It works even when blood pressure is high for, well, no single clear reason, essential hypertension. And it's particularly useful for what's called resistant hypertension. That's when blood pressure is still high, even after you've tried several other meds.
So like a step-up medication.
Kind of, yeah. Its way of blocking aldosterone seems really helpful when other things haven't worked. Studies have actually shown it can be better than some other fourth-line drugs, like bisoprolol or doxazosin.
Better than those.
In some studies, yeah. And at least as good as, maybe even preferred over, another one called clonidine for lowering blood pressure. It's also a primary treatment if someone just naturally makes too much aldosterone hyperaldosteronism.
So definitely a major player in heart and blood pressure management. What about that fluid retention aspect, the edema?
Yes, it's used for that too. Edema that's linked to, say, liver cirrhosis or a kidney problem called nephrotic syndrome, especially if other treatments aren't cutting it. And also in a congestive heart failure edema.
Right.
Often it's used together with other diuretics like furosemide, maybe metallism.
Because it spares potassium.
Exactly, can help balance out the potassium loss you might get from those other diuretics.
Makes sense. Are there any maybe less common uses we should know about?
Well, it can be used to treat low potassium levels, hypokalemia, if that's caused by other diuretics, and maybe potassium supplements aren't enough or aren't suitable.
Right.
And then moving away from the heart and kidneys a bit because of its anti-androgen effect.
The testosterone blocking.
Right. It's been studied and used for things like acne in adult women.
Agony. Interesting.
And hirsutism, which is
Uh.
excess hair growth in women. It also had a role historically in transgender hormone therapy, though nowadays there are often more specific options preferred for that.
Wow, okay. That is a really diverse set of uses for one medication. So how does it actually do all this stuff? How does it work?
So the main action happens in the kidneys. It basically gets in the way of that hormone aldosterone we mentioned.
Okay.
Aldosterone normally tells the kidneys, hey, hold on to sodium and water and let go of potassium.
Right.
Spironolactone blocks that message. So the kidneys do the opposite. They get rid of more sodium and water.
Which lowers blood pressure and reduces fluid buildup.
Exactly. That helps in heart failure, edema, high blood pressure.
Okay.
And at the same time, because it blocked aldosterone's other instruction, the body holds on to more potassium.
The potassium sparing part again.
Precisely. And then there's that separate anti-androgen effect. It binds to the receptors where testosterone would normally act and blocks them.
So it reduces testosterone's effects in the body.
That's the idea, yeah.
Yeah.
Which is why it's used for things like acne or hirsutism sometimes.
Okay, I think I'm getting a handle on the what and how.
Mm.
Now let's shift to the really crucial part.
Yeah.
What do people taking this, or maybe about to start, absolutely need to know? The considerations, the side effects.
Yes, absolutely vital. The number one thing, the most common serious issue is high potassium, hyperkalemia.
We keep coming back to potassium.
Because it's critical. The risk is higher if you already have heart failure or kidney problems.
Okay.
And it goes way up if you take spironolactone with other things that also raise potassium.
Like other medications.
Yes. This is why regular blood tests are non-negotiable. You have to monitor potassium levels. Seriously, high potassium can cause dangerous heart rhythm problems. It can even be fatal in some cases, so doctors watch this like a hawk.
Okay, super important. What about those other medications it interacts with?
Oh, the list is pretty long. Other potassium-sparing diuretics, obviously, but also ACE inhibitors, ARBs, those are common blood pressure meds, NSAIDs like ibuprofen, heparin, lithium, digoxin, abiraterone. Even aspirin can interact.
Wow, even common painkillers like ibuprofen.
Yep. And definitely avoid salt substitutes that contain potassium. Big no-no. The risk of hyperkalemia just shoots up.
Right, those low sodium salts often replace sodium with potassium.
Exactly. So medication interactions are a huge point to discuss with your doctor or pharmacist. Make sure they know everything you're taking.
Okay. What about food? You mentioned potassium-rich foods earlier.
Yeah, diet's another consideration. Traditionally, the advice was pretty strict. Limit high potassium foods, bananas, avocados, beans, nuts, salmon, that sort of thing.
Right.
But more recent thinking is a bit more nuanced. For some people, maybe younger folks taking it for acne who are otherwise healthy, that super strict restriction might not always be needed.
So it depends on the person and why they're taking it.
Pretty much. The key takeaway is have that specific conversation with your doctor about your diet when you start spironolactone. Get personalized advice. Don't just guess.
Okay, good advice. What about other maybe more common or less severe side effects people might run into?
Well, stomach issues can happen. Things like nausea, maybe vomiting, diarrhea, cramps. Taking it with food often helps minimize that.
Okay.
Some people get muscle cramps. If they're unusual, not just from exercise, definitely mention it to your doctor. Could be an electrolyte thing. Feeling tired, low energy, that can happen too. So, be cautious with driving or using machinery if you feel wiped out.
Okay. And I think I read something about breast changes.
Yes, that's possible. Breast pain or enlargement can actually happen in both men and women.
Oh, okay. In men too.
Yep. And women might notice changes in their menstrual cycle irregularities.
Right.
Then there are potential nervous system effects, dizziness, drowsiness, headache, feeling lethargic, maybe confused, even ataxia, which is like a lack of coordination.
That sounds unpleasant.
Yeah. And while rare, serious allergic reactions are possible. Swelling, trouble breathing, a bad rash. Those need immediate medical help.
Absolutely. Anything else on the side effect list? Kidney or liver?
It can potentially affect kidney function, which is why monitoring is key. And very rarely there have been reports of liver toxicity. So caution is usually advised if someone already has liver issues. Low blood pressure can also occur. And it's generally not recommended during pregnancy because of potential risks to the baby's development.
Okay. Breastfeeding.
A breakdown product of the drug does get into breast milk and could potentially harm the infant, so that's usually discouraged too.
Right. And overdose. Is that a major concern?
Thankfully, a one-time overdose is generally considered relatively safe in terms of immediate life threat. The main worry, again, is hyperkalemia, especially if kidney function is poor. There's no specific antidote. Treatment is just supportive care.
Okay, that's a really thorough rundown of things to watch for. So if someone is prescribed it, how do they typically take it? What's the routine?
Usually it's once a day, most often in the morning.
Why the morning?
Well, because it's a diuretic, it can make you need to pee more. Taking it in the morning means that's less likely to disrupt your sleep.
Ah, practical.
If the doctor prescribes it twice a day, the second dose is usually best taken before, say, 4 p.m. for the same reason.
Okay. And you've mentioned taking it with food.
Yes, definitely recommended. Helps with potential nausea and absorption. And the absolute key is follow your doctor's instructions exactly on the dose and the monitoring schedule.
And don't double up if you miss a dose.
Correct. Never double up. Just take the next dose as scheduled or check with your doctor or pharmacist if you're unsure.
Got it. What about cost and just getting hold of it? Is it expensive? Hard to find.
Well, the good news is because it's available as a generic.
Right. You mentioned generics.
Yeah. That usually makes it much more affordable than brand name only drugs. Prices can still vary a bit from pharmacy to pharmacy, though.
So it pays to shop around.
It can, yeah. Using something like GoodRx online can help you compare prices locally, maybe find coupons.
Useful tip. Okay, so let's try and pull all this together. We've covered a lot of ground. What's the main takeaway for you, our listener, from this deep dive?
I think the main thing is that spironolactone is clearly a really useful versatile medication. It offers major benefits for serious conditions like heart failure and tough-to-treat high blood pressure. But yeah, there's always a but with potent medications. You absolutely have to be aware of the potential downsides, especially that risk of high potassium, the hyperkalemia, and the fact that it can interact with so many other drugs, and even your diet needs consideration.
It really highlights how important that conversation with your doctor or pharmacist is, doesn't it?
Absolutely essential. If spironolactone is part of your plan, you need that open communication. Understand why you're taking it, know about the need for blood tests, recognize the symptoms to watch out for.
And make sure they know everything else you're taking.
Everything. Prescriptions, over-the-counter, supplements, it all matters for using spironolactone safely and getting the benefits.
So here's maybe a final thought to leave you with. We've talked about how spironolactone works on hormones and fluid balance. Given these multiple actions, what other, maybe unexpected uses could researchers uncover for this medication down the line, even though it's been around for decades?
That's a great question. It's a good reminder, isn't it? Even well-established drugs can sometimes surprise us with new possibilities as we learn more.
Definitely food for thought.